Hello everyone. Today's video is all about methylene blue. Lots and lots of methylene blue questions, so I figured I'd just do a full methylene blue Q&A video. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you don't mind taking a moment at some point to please like, share, subscribe, and or post a quick comment on this video, I'd really appreciate it. So thanks in advance for taking a second to do that. Still working from home, family members still in the hospital, getting better every day. Thanks so much to folks who have left messages and comments wishing my family member and my family and I well. So thanks so much for that. He's getting there. Hopefully, January I'll be back home and I'll be back in the office and everything will be back to normal. So without further ado, so first question here, it says, I was about to try methylene blue on my 87-year-old mother and had the foresight to check on contraindications for the med she's on. She is on 30 milligrams of duloxetine. Also 11 milligrams of prednisone daily and 300 milligrams of hydroxychloroquine. Also 12.5 milligrams of hydrochlorothiazide. If I wean her off the duloxetine, how long before I can start her on methylene blue? Are any of her other meds contraindicated? Thank you so much for making this video. So thanks for the questions. As you know, I can't give any tailored advice to anyone over social media, but just speaking about this academically. So, when it comes to methylene blue, the main med class that med types that we're concerned about are things that are going to boost up serotonin in one way, shape, or form. So thankfully, blood pressure medications, so medications like hydrochlorothiazide, medications like okay, well anyways, so blood pressure medications like hydrochlorothiazide, medications like prednisone, those don't have any known, to my knowledge, any known impact on serotonin levels. Duloxetine can, of course, or does, of course. But generally speaking, like with methylene blue, it thankfully, to our knowledge so far anyways, does not seem to interact with a wide range of different medication classes. Now, it's one of those things where, when I read or when I have a patient who's, 87 years old, I'm thinking like, we want to be a little extra cautious. We want to take into account like a patient's overall constitution, vitality. Now, I have some 87-year-old patients who are healthier than my 50-year-old patients, healthier than some of my 40-year-old patients. And then, of course, there are some 87-year-olds out there that are not the most robust with their health. So we want to kind of take that into account too, because as much as methylene blue can be really, really helpful, great antioxidant, great antimicrobial support, depending on the dose we're using, all that good stuff, helps to clean out the mitochondria, to my understanding. We want to be careful at the rate at which we do that, because it can really throw people through a loop. As we'll see in the next questions coming up, some people, who are much younger than 87, they could flare from it pretty easily. So we have to be cautious with that. As far as, weaning off periods for SSRIs or SNRIs or, various drugs like that, like things that are going to have an effect on serotonin levels, in my practice, generally speaking, I tend to be on the more cautious end of the spectrum. So with drugs like that, to my understanding, once we're off of them, it's usually about a 6-week washout period, give or take, where it's really probably not having much effect, or probably not having much impact on our say serotonin levels anymore. That's probably overly cautious, depending on the patient's overall state of health and et cetera, but that's usually what I recommend it for my patients. So again, as always, talk to your healthcare provider, talk to your mom's healthcare provider about exact recommendations for things like this. But it's not like for one of my patients to say, oh, you've got to be off that for 3 months or something like that, unless there were some really nuanced factors to consider with their case. But by and large, those are my thoughts on that. So I hope that's helpful, and I will leave it there on that one. Next one is, okay, it says, so person's wishing my family and I well, so thank you again for what's going on with my family member. So it says, not sure if you've covered this aspect of methylene blue yet, but I was wondering what sort of effect methylene blue has on each of the thyroid hormones. Having recently achieved conventional thyroid ranges from years of being hyperthyroid, I'm doing my best to keep my levels within range, while also needing some help with fatigue, etc. Thank you for sharing your insights. So thanks for the question. Yeah, I haven't come across any information one way or the other in terms of methylene blue directly impacting thyroid hormone levels. I think in a indirect way it could have an impact, because whenever we're working on well, really any element of our physiology. It's going to have an impact on the mitochondria, and the mitochondria are really the main activating the mitochondria in various cells in our bodies are really the main function of the thyroid hormones. T3 more than T4, but they're both biologically active. And so, like in a sort of indirect way, there'd be an impact there. But in terms of, methylene blue either, raising or lowering TSH levels or T3 or T4 levels, or making those hormones work better or not as well, I haven't come across any information to suggest that it would have an impact. I can't really think of how it reasonably would. You never know. I don't believe, done any studies actually looking at it. But for my patient, if I had a patient with hyperthyroidism, hypothyroidism, I wouldn't really be thinking like, oh man, I've got to be really careful with methylene blue in this particular case. Now, of course, if there was a patient again who was in a frail state of health, or a patient who with hyperthyroidism, we want to be extra careful. Like if someone's has unmanaged hyperthyroidism, that probably wouldn't be a time where I would be thinking, oh, let's start doing some methylene blue detox or something like that. But by and large, I don't think that it really factors in a whole lot based on a patient's thyroid status. By and large. If there's any follow-up questions to that, just post in the comment section below. But those are my general thoughts on that topic. And the last one is, oh, right. So it says, I took one drop of methylene blue and had to go to sleep the rest of the day. My legs were weak. I hadn't anticipated this, and it cut into a busy schedule. Maybe I take it at night for a while, take some detox support an hour later, ? So yeah, thanks for the questions. Isn't that just the way, whenever I start a new supplement nowadays, where I've been bamboozled a couple of times with, going on things and going on a dose, too high too quickly. I tend to, wait until either the evening or the weekend, just in case. Because when you have a full day of patients, you don't want to be having diarrhea or, whatever, feeling crummy or spacey or something like that. So I tend to be cautious with when I start my new supplement regimens. Some folks certainly do report having, a sleepiness effect from methylene blue. I'm just looking in the comment section here. Somebody 6 months ago on the same video said, literally fell asleep within an hour or two after taking 10 drops. I would say in my experience, I don't think I've yet had a patient who has a sleepiness effect from a soporific effect, as they say, from taking methylene blue. But I've had a few folks who have commented on some of my videos that happens to them. In terms of weak legs, I guess the one thing I was thinking is what's the source of the methylene blue? Is this coming from an uncontaminated source? And I'm not casting any shade on any particular company or anything like that, but that is just one of the concerns that, is the methylene blue that folks are taking, is it designed for human consumption? The concern being you don't want there to be some cross-contamination with heavy metals. Probably not a likely factor, but just something to think about or to mention there, cross my brain. But generally speaking, with my patients, sometimes they get sleepy when they take their adrenal gland support. They get sleepy when they take their detox support, their glutathione, things like that. And I say, yeah, take it before you go to bed. That seems, if it's helping you to sleep and you're not getting the side effects, when you're during your waking hours, and that's great. With methylene blue, a lot of folks, in my experience, will take it just once a day. Twice a day is what I typically recommend, but it could just be once a day. And in that case, doesn't probably matter what time of day it's taken from a overall therapeutic perspective. So, if it was making one of my patients sleepy, it's why not take it before bed? And then in terms of the question about taking some detox support an hour later, it's a good question. That if I had a similar case in my practice, it'd be something on my sort of DDX list as to why they're having that sleepiness effect. I would generally be expecting there to be other symptoms, though, besides tiredness and or leg weakness. I'd be thinking about skin eruptions coming up, or bad breath, or some body odor, or some funky smells, or maybe getting headaches or things like that. Maybe not necessarily just leg weakness, but it's a good thought. And maybe that's something that would be relevant for a case like this, but wouldn't be my first thought. But I've certainly had some patients where they seem to need to take some detox support, either leading up to or following an agent that seems to be causing a detox reaction. Thanks for all the questions. Always happy to talk about methylene blue or whatever else folks want to hear about. So if you have questions about methylene blue or other topics, just post in the comment section below, and I will do my best to answer as soon as I can.